Pancreatic cancer has the best treatment outcomes when diagnosed at an early stage, but early pancreatic cancer is often asymptomatic. And the first warning signs of pancreatic cancer often overlap with other, less serious conditions. This means that many people with pancreatic cancer do not seek medical attention or receive a diagnosis until the cancer has spread. Knowing the warning symptoms of pancreatic cancer can help you see a doctor or healthcare provider as soon as possible. Get diagnosed and begin treatment before your cancer has a chance to spread. In this video, we'll take a closer look at the signs and symptoms of pancreatic cancer and when to see a doctor. The hardest thing about pancreatic cancer is that people in the early stages of this cancer may not experience any symptoms. Sometimes even the later stages can be easy to mistake for less serious conditions. It is important to see a doctor if you have been experiencing any of the symptoms of pancreatic cancer for more than 1 or 2 weeks. Although these symptoms can also be caused by other, less serious conditions, it's a good idea to get them checked. Once symptoms appear, they often include jaundice. Jaundice is the medical term for yellowing of your skin and eyes. It is often one of the first symptoms of pancreatic cancer. It is also associated with more common conditions such as gallstones and hepatitis. Jaundice in pancreatic cancer occurs because a tumor blocks the bile duct. Your liver's bile duct is what allows bile, and a byproduct of liver function, called bilirubin, to be released. When your bile duct becomes blocked, bilirubin accumulates. This causes jaundice, itching on the skin, and dark-colored urine. Bilirubin build-up can also cause dark urine and skin itching. A blockage of the bile duct can also cause a change in the frequency or consistency of your bowel movements, nausea and vomiting. Pancreatic tumors can grow near the end of your stomach. This can prevent food from passing through your digestive system. Congestion can cause nausea and vomiting. Pancreatic tumors can put pressure on nearby organs, causing pain. This is most common in your stomach, but back pain can also occur. Stomach or back pain is often a symptom of an enlarged tumor and is more likely to be caused by other conditions, but it's a good idea to talk to a doctor about any pain you're experiencing. Pancreatitis versus pancreatic cancer. Pancreatitis is inflammation of the pancreas. Acute pancreatitis is a short-term infection. Chronic pancreatitis refers to a long-term inflammation that leads to scarring and severe pain. It can be very difficult to tell the difference between chronic pancreatitis and pancreatic cancer without a full diagnosis by a doctor. Early symptoms of pancreatitis include 1. Loss of appetite, 2. Unintentional weight loss, 3. Nausea and vomiting. For jaundice, 5. Frequent urination, 6. Abdominal pain. There are several known risk factors for pancreatic cancer. Having risk factors does not mean you will get pancreatic cancer, but it increases your chances. Risk factors include pancreatic cancer appears to run in some families. It is estimated that approximately 10% of people with pancreatic cancer have an inherited gene mutation. It is still being investigated whether the mutations that cause pancreatic cancer are certain. Age increases the risk of pancreatic cancer. Most people are 55 or older when diagnosed. Smoking is associated with a higher risk for many types of cancer, including pancreatic cancer. Type 2 diabetes has been shown to increase your risk of pancreatic cancer. There is a link between high body weight and pancreatic cancer. Exposure to chemicals used in industries such as metalworking may increase your risk of pancreatic cancer. People assigned male at birth have a higher risk of developing pancreatic cancer than people assigned female at birth. However, people assigned male at birth also have higher rates of risk factors such as smoking and metalwork. So, what should you eat to maintain pancreatic health? The pancreas produces the enzymes necessary for the digestive system in your body. The pancreas helps maintain general body health by balancing blood sugar. If you have an irregular and unhealthy diet, the pancreas is seriously affected. While nutritionists recommend that you consume foods that are good for the pancreas, It also emphasizes that you stay away from foods and drinks that tire the pancreas. When the pancreas gets too tired, it fights inflammation and diseases like cancer. Inflammation of the pancreatic ducts has dangerous health consequences. In order to avoid this risk, it is recommended that you consume foods and plants that are good for the pancreas mentioned in our list. Inflammation occurs during periods when the pancreas gets tired. In this case, the question arises in mind, what is good for pancreatitis? Thanks to the antibiotics it contains, garlic produces the enzymes necessary for the pancreas in a healthy way. Try to consume garlic raw and cooked. Cinnamon, which draws attention with its antioxidant properties, is one of the answers to the question of what is good for pancreatic pain. You can protect the health of your pancreas by consuming cinnamon as a spice, in drinking water and on yogurt. Cinnamon protects you from pancreatic inflammation and pain. You can dry the Echinacea plant and consume it as tea. If you wish, you can use the dried form of the plant in salads and sauces. Echinacea tea is recommended regularly for those who experience pancreatic pain. Juniper berry has the effect of relieving pancreatic diseases. Regularly consume juniper berries ensure the healthy production of enzymes. Thanks to its vitamin and mineral richness, it is recommended to consume probiotic foods. To prevent pancreatic diseases, one of these foods is yogurt. When yogurt is homemade, it helps the pancreas function properly and prevents sugar from being stored in the body. Consuming one portion of yogurt at every meal prevents inflammation of the pancreas. Spinach, which is the body's source of iron, is one of the foods that prevents pancreatic inflammation. When spinach is cleaned and washed very well, it can be found on your plate as a food that cleans pancreatitis. Broccoli, which contains dietary fiber, is a vegetable that helps the adequate secretion of pancreatic enzymes. Consuming fresh broccoli in season prevents pain and ache in the pancreatic area. Mushroom is an easy-to-digest food and is recommended for pancreatic patients, since it would be healthier for pancreatic patients to choose low-calorie foods. Mushroom consumption should be considered important. Black grapes are a fruit that purifies the body. If you have pancreatic disease and have been experiencing aches and pains lately, you should consume black grapes in dry or fresh form. Black grapes, which help clean the pancreatic ducts, will provide you with a healthier body. Thyme, which is used to add flavor to meals, has the task of clearing pancreatitis both in its fresh form and as a spice. Those who consume thyme have a reduced risk of diabetes and a healthier pancreas.